Hello, Dr. Graivier. How are you?
Good to see you. How are you, Shashi?
Good, good. So I'm going to refer you with your first name, Miles, if that's okay, because we're just
Absolutely.
chatting. So this is a very special conversation that we're about to have, at least to me, and I hope to the audience because it is quite an inspirational story. But there's a little bit of backdrop to why we're actually doing this. First and foremost, medicine is all about human connection. It's all about taking care of human beings on a very personal, intimate level. And most of the time, we as surgeons and physicians are on the other side of the table and not on the receiving side. And this is a story about that, and specifically about you being on the other side and what you went through to come back to the side that we usually sit on, or maybe you're straddling both sides still. And the story that you shared with me was absolutely unbelievable and stunning. And then I felt that we have to discuss it at length, and we have to share your story because it is quite inspirational on one end, and as with most things in life, at least in my life, something that affects you can either take you down or inspire you further to do something with it, to benefit you and your family and society at large. So in this case, I think as innovators and entrepreneurs, both of us probably are in the same bucket to say that, you know what, I'm going to take what I got, that life threw at me, and I'm going to make something of it to benefit everybody. So on that level, not just sharing the story, but there's a second part to this, which is that how do we take this and improve what we do in our healthcare lives, and how we take care of patients? That's the second part of this conversation. That's another important and interesting thing that is going to come out of this conversation, as people start to listen to us, right? Talk about it. So let's do that in two phases. And so I'm going to quickly have you introduce yourself. After I introduce myself to the audience that doesn't know me, my name is Shashi Kusuma. I'm a plastic surgeon in South Florida. I'm also the founder of this company, SymCast, and I've been at it for quite a long time. And this inspiration is what drives me to do what I do every day. And whenever I meet people of like-minded, kindred spirits, I love to engage in a conversation. So, Dr. Graivier, Miles, please introduce yourself to the audience.
Well, thank you, Shashi. And like Shashi, I'm a plastic and reconstructive surgeon, and I've been doing this for a long time, 33 years in practice. And it's been quite a journey and a revelation. And as you have so well verbalized, it's something that my journey has changed me, changed my outlook, and given me the I thought I had empathy before, but certainly I think it's multiplied by many times of being on the other side. It definitely is a uncomfortable feeling, and yet coming out the other end after some very interesting and I will say somewhat miraculous things that I've been the beneficiary of. It certainly has given me a new perspective, a different perspective, which I can wish to continue to push forward and impart some of the things that I've learned and I've shared with you, and hopefully we can share with many people. It's really the first time that I've had the opportunity to sit down and codify this, if you will, really talk about it, and I will say it's somewhat cathartic as well, but also makes me very grateful that I've been able to come out this other end and impart some of the things that I've learned about how we address disease processes and life in general, as well as the afterlife, which unfortunately I've had a glimpse at. So I do have a little bit of insight into that as well. So,
Well, I don't know if it's unfortunate or fortunate, but we can look at it either way. But so, Miles, this is why this is, like I said, inspirational, miraculous. It's just an unbelievable story. So why don't you walk us through what happened, in the last couple of years in your life?
and if I get long-winded, please interrupt me because certainly it's near and dear to me, and I kind of marveled that it happened as well. And interesting enough, my story starts like many people's story during COVID. And I know exactly it was in April of 2021, when, as usual, in the middle of the night, I would have some divine providence, some idea that would wake me at 2:30 in the morning and cause me to come downstairs and try even put most of my good ideas, just like you, I think, happen in the middle of the night. That may be ADHD, I don't know, but it is kind of funny. And I padded downstairs and was just walking around and getting a little snack and kind of trying to think what my subconscious had placed there. And I happened to reach up and I felt a little teeny spot that was just above my collarbone here. And feeling this little spot, it was about the size of a peanut, not a full peanut, but a little bitty peanut, really 9 millimeters, less than a centimeter in size, but it felt a little firm. And being a physician and clinician, I knew it just didn't feel quite right. There just was it was just shouldn't have been quite like that. So I immediately felt all around and ordered some of my own tests. Of course, that's what we do. I think, I ordered CT scans everywhere, and I went and saw my primary care physician. And I was not going to ignore this. I got ultrasounds, and I went and saw my otolaryngologist, which is a ear, nose, and throat specialist. And he looked back in my throat and didn't see anything. And the CT scans and ultrasounds came back with just a lot of little lymph nodes that were in my area above my collarbone, in my neck, in my chest, kind of around my windpipe, but they were teeny. The largest one was this one that was 9 millimeters. And after the full workup, when putting heads together with lots of very smart people and showing this to a lot of my clinician friends, we all decided that really it could be anything. It could be inflammation. It didn't look suspicious at all. But we decided to watch it for anywhere from 4 to 6 months to see if it would just go down, because if it was an inflammatory process, it would probably go away. And of course, as busy plastic surgeons, we tend to ignore ourselves to our detriment, but we have other concerns with our patients and our family and friends and went about our business. I felt great. But finally, my primary care physician had come by and I was seeing her, and she said, is that spot still there? And this was about 4 to 5 months afterwards. And I said, well, yes, it really hasn't changed at all. And meanwhile, I was still exercising 5-6 times a week and felt great, had no change at all in my energy level. And they used to call me the Energizer Bunny because of the amount of surgery that I would do, 14 hours at a time and just nonstop, go, 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 go. And she said, you promised me that if it hadn't changed, I would get it biopsied. So, of course, I looked her in the eye and I said, you're absolutely right. I'm going to do that. So, of course, the next day I go in the end of October on Halloween, turns out, and got an ultrasonic biopsy, ultrasound-guided biopsy, and didn't think anything of it. And a week later, I was coming down into your neck of the woods. I was giving some talks at a meeting down in Miami. And I was going to go out with my son and take his friends because he's in marine biology at University of Miami. And I'm getting off the plane, and I had some other meetings with some people for developmental ideas, the things I came up with at 2:30 in the morning usually, and some CEOs and things like that. And I get off the plane, and there's a message, and the message says, call me. And that's never a good sign. I think I might have a little PTSD at H7 at the Miami airport at the gate that I usually end up coming into. So I sat down and I called my primary care physician, and she said, well, are you sitting down? And I said, yes. She says, well, that's a squamous cell carcinoma, and it's probably coming from your oral cavity somewhere. And I was truly stunned and floored. And of course, my reaction was, you're kidding me, right? I feel fine. That it can't be. That's the usual response when we find out something like that. But it's 7:00 at night, and I had meetings to go to that night with people that I'd scheduled with, and the meetings the next day. And of course, it was became a very long weekend. I immediately got on the phone and tried to make arrangements and see what my next steps were, and then go down and act like nothing was wrong, giving my talks all weekend and going out with my son and his friends, and in the meantime, trying to figure out what I'm going to do next.
So far, you didn't tell your family about any of this or colleagues about it?
Well, I called that night after the meetings at about 10:00 at night. I called my wife, and I called some friends. physicians also that were at Houston, and as background, I had been a visiting professor at MD Anderson back in the 90s, and had been in medical school at University of Texas in Houston. So I knew a lot of the people at MD Anderson, and I always felt that in certain specialized situations that it would be uh, going to the cancer center would probably be the right thing. But I didn't know enough about it, because you and I, fortunately or unfortunately, when we have treat patients with cancer, we would do our surgery, and then we would send them off to the oncologist and the radiation therapist, and about 6 months later we would see them again after they had gone through this. So I didn't have a good understanding of the things that my patients would go through at the time. So afterwards, I came back to Atlanta, where my practice in the northern part of Atlanta suburbs, and I saw an oncologist and a radiation therapist. And I basically said, "Oh, so we can get this thing treated, and I'll be back doing surgery. I'll do surgery during the time, and I'll be back at work in like 3 weeks." And they kind of looked at me and they said, "No, that's not exactly how it goes." And so I soon
But
became.
then you said you don't know me.
Exactly. Well, because the first thing the oncologist says is, well, you're going to have your tonsils out and biopsies all in your throat to figure out where exactly this is coming from after the PET scan. And then while they're there, they might have to put a feeding tube in, and maybe they'll put a central line to give you your chemotherapy. And I looked there and I said, well, first of all, no. That's all the things I am not accepting that is the way that I'm going to have this treated. And after having the tonsillectomy and the PET scan, which shows where it was coming from, which was coming from my right tonsil and some from the base of my tongue, a lot of more people have been diagnosed recently with these P16 positive or HPV positive squamous cell cancers of the oral pharynx in men and women. And
So just so people know, the audience knows HPV, human papilloma virus, the common
yeah,
virus that many of us may be carriers of.
absolutely. And viruses sit in the system for years and years, and that's why now I recommend certainly that people of all ages get the Gardasil, the vaccine against this.
Well, you may have a hard sell in this environment with that miles as has happened with COVID. So it'll be a hard sell for people to trust any recommendations, seems like lately. But
Agreed. There have been a few studies, though, that have shown that getting the Gardasil vaccine, even after a diagnosis, has some improved results and outcomes with it. So it's not; they're not mRNA vaccines actually. So that's a good thing with that regarding that. So, but either way, I got the scans and I got the tonsillectomy. And I called my colleagues and friends and the head of head and neck oncology at MD Anderson. I sent them all the information. And I said, so Randy, his name is Randy Weber, semi-retired, just very knowledgeable, been the head of head and neck oncology at MD Anderson for many, many years. And I said, so is the art form a lot different at MD Anderson than anywhere else? And he said, well, yes, you have some extenuating factors where it looks like all these nodes are positive. You do need to come here, and I'll set up all of your appointments and everything there. So I made arrangements. I had my tonsils out. I actually gained 10 pounds in the week afterwards and took a half a pain pill. Tried to start to use my Eastern medicine, if you will, my mind over matter, because I am very stubborn. And I flew down to MD Anderson and all the things that I told you before that I had said I don't want a port for the chemotherapy. I don't want a feeding tube. I'm going to fix this. They had a fantastic integrative medicine program, and they said, absolutely, we do not want you to have a port. We do not want you to have a feeding tube. We want you to eat. We want you to do a variety of other things, such as acupuncture, such as a yoga study designed for head and neck cancers for your treatment, which all things combined turned out to be godsends. And I think very important that we meld kind of our Western and Eastern ideas and medicine, and help me to an extent that we'll certainly discuss, but it was really phenomenal then, and
So
something that
just to summarize, Miles, so two things that stand out, from a summary perspective. One of which is that you took control of your own healthcare. You didn't delegate it to somebody, and you didn't just agree to everything that was said. You wanted to be involved. You took ownership of your own health. That's one that stands out, because many times, patients may not feel so empowered as you do because you're knowledgeable and you have a certain personality, but it's generally a good idea to own your own healthcare management to the most part, right? The
absolutely.
second thing that you said is also that you are open-minded enough to incorporate not just allopathic medicine that is involved with medications and just chemical treatments. You also went the, perhaps you could call it, the spiritual route, or the alternative. And I don't even want to use the word alternative because that sounds like secondary, but it became a primary source of treatment, for you, which should not be discarded. As a matter of fact, which should be embraced.
Absolutely, very eloquently put. And of course, in the entire time I was researching this, and they happened to have a fantastic integrative medicine program at MD Anderson, where that offered all these things, including the acupuncture and the yoga study, as well as nutritional consults and consults with which is interesting because the nutrition changed from the time when I was receiving the immunotherapy and chemotherapy as induction to shrink a lot of these areas prior to the radiation therapy, where the needs and the taste and the variety of things also changed. And they had a different nutritional complement, as well as swallow therapist, speech therapist. And, in other words, we were not ignoring the other areas, I think, that need attention, as opposed to just following along with what is said and applied.
See, but another thing also, Miles, I mean, maybe you can shed some light, because we're trying to share a real story of you as the patient here. So one thing is having knowledge. There's this tool available, there's that therapy available, there's this acupuncture available, there's yoga available, but a big part of what humans suffer, especially patients suffer, that we manage is motivation, you know and because knowledge can only take you so far, but there has to be some internal drive that motivates you. Where did you derive that from?
It's a great question, and I think that we all have to find our inner drive. And you and I know that as part of our training, where when we were general surgeons, first in part of our training, the plastic surgeons, we averaged about 110 to 120 hours a week, which was pretty insane when you think about it. But I've always been of the mindset that I accept any challenge that comes my way. But I also think that the power of the mind in pushing you forward to way past what you think your physical limits are is a very powerful tool that we rarely get to exercise to the extent. I've always been a believer in that, and I've always been a believer in myself. And I knew that it's one step in front of the other, one thing at a time, but keep your eye on the prize. That never give up, never give in. Whether that's just something in the makeup, but I think it's in everybody, and it has to be, because the mindset is so important, and then we ignore that a lot of times. And yes, it's easy to get down. It's easy to say, why me? But that's fine, and we're allowed to do that. That's human. That's part of the human condition. But then you have to say, okay, I've had my moments to feel sorry for myself, but now it's time to get to work. And I have no excuses. I'm going to do everything, and I'm going to go far beyond what I think my limits are, and nothing's going to stop me, because I have a lot to live for. And that's the mindset that I attack all problems with. But even this far exceeded. You know, I like to say I used to think I used to think I was pretty tough. I just unfortunately had to prove it. And I think that we have to get through that. That we can all do it with some encouragement. But the other part is, no one does it alone. I'm always surrounded by people, by my friends, my family, and they were there for me even in my times, but they never allowed me to doubt. I could feel sorry for myself for a few minutes, but it never lasted long. And so when I did find out, of course, that I was going to have to undergo 5 months of 9-hour treatments of immunotherapy and 2 chemotherapies, which had the potential to affect my fingers, my sensitivities. I then researched that, and I put cold gloves on my hands and feet before the chemotherapeutic agents that could do that, and would go out immediately after my 9 hours of chemotherapy, and I play 3 hours of pickleball and hydrate, and I walked 3 miles every day, and did my yoga every day, even when it felt like I had a refrigerator on my back, and each step was painful. And I knew I had to get my calories in, because I was not going to take that feeding tube. I counted my calories, and what I could eat, I would eat. I found with nutritionist help, family help, that even if it took me 3 or 4 hours to get the meal.
Did you do any special diet, or was it also part of that whole integrative medicine?
They had nutritionists both for the chemotherapeutic portion of it and then for the radiation portion of it, where it changed. But yes, we definitely changed my diet, a lot more cruciferous vegetables, eating a lot cleaner, no sugars at all, drinking 120 ounces of water a day, which is not easy, by the way. And I could have 1 cup of coffee in the morning. But if I did, I would have to balance it out with another 10, 12 ounces of water a day. So that was certainly, I think the coffee was maybe my hardest thing to give up or limit myself. I'm sure you might feel the same way if you're a coffee drinker or addict, as you may be, but I certainly was. But obviously I had to change that in that aspect. But yeah, that was it was a tough time. And of course I had numerous issues or complications, but I kept going. I got hepatitis from the immunotherapy, had to be on high dose steroids. But finally, after 5 months of that treatment, I started my radiation therapy every day for 7 weeks, and more chemotherapy. But it kind of led to probably the hardest thing that I had to overcome. And that is, as we had talked about, you and I, we don't know that much about radiation therapy. We would send people away, and they would get it, and then they come back. And the same thing with the chemotherapy, essentially. But they had to make a bite block for myself that would freeze my jaw and my tongue in a position kind of underneath the front of my teeth. Very hard to swallow. And then they made a mask, essentially a whole one that fit over my chest, and I will send pictures of that. And that held your head in this position. And then they would strap you down and do the proton therapy for about 45 minutes. But the very first time that I did that, it was about 2 hours of what they call CT and MRI planning. And I had to have them stop twice because I get claustrophobic, and I couldn't, and I tried to swallow, and it's almost impossible to swallow without moving your tongue, and your salivation is much increased when you're getting this kind of treatment. And it truly was the only time that I had just a little doubt of whether I could do it or not. But after learning yoga techniques, and I know you are an aficionado and a studier of these as well, I found that they offered medication, and I said no, I'm not going to use medication. I'd already been practicing the yoga as prescribed, swallowing techniques, but also the mind over matter techniques. And I found that when I was able to finally start that treatment, that I actually was able to get into my breathing patterns and go to the place that I'd been practicing to go to, and would actually fall asleep during the treatments. So
here's a point where, Miles, I think, for the benefit of the audience, I do study this, or not just study from an academic intellectual perspective, but I'm a practitioner of it. And I come from the place that it originated, from India.
Yes.
And so it's very near and dear to me. And so this yoga, a lot of people confuse it for just stretching and physicalness, but actually yoga means union, kind of a union of you with bigger forces than you. as you're part of. And I think like the components of it, like you said, the physical part of it is one component, but a small part of it. And then breathing, what we call pranayama is the other part of it. And then the
Yes.
third one is the meditation, which is the mind component or the beyond the mind component. So all of those are integrative similarly to integrative medicine, which sounds like you've done all of them.
Yes, and it was quite nice and fascinating in that they at the end they called and they said that you've broken the curve so far that and done so well with this that they're going to now offer it to all their patients with cancer at MD Anderson. So that made me feel, of course, very good and I think beneficial. But there is absolutely no way that I could have done this without perhaps medication every day, which I absolutely refuse to do. Without, as you said, the techniques that I learned and still practice today, and that's a very important thing. And as you said, I consider it a integral part of anybody going through these kind of things, um, that we do not do enough here when we practice our Western medicine, if you will. So thank you, and I do hope that we can even do some podcasts where we can even get a little bit more into that, and as well as discussing some things that we can do to,
Yeah, I mean, just again, we're trying to impart some takeaway points for patients in this case. So there's an organization called the Art of Living, which is something that I know and I kind of work with to some extent. And we are in the very very early phases of discussing, and I know many of these studies have been done, but not in plastic surgery per se. Is that there's a real benefit? Like you didn't take any medicine, you said, right? So I think
yeah,
if you adopt these before surgery, for example, and
yes,
get proficient at it for a month or two, and you kind of discipline and get that motivation, internal motivation to do it, I bet you could prove that you would not need much pain medication afterwards. You would not need much anxiety medication afterwards. The general sense of well-being would probably be better, and your health would be better. Because you and I, in the hospitals, we tell patients to do the incentive spirometer, the breathing thing. I mean, people don't do it well. They don't want to do it. It's kind of they have to be told to do it. But as you adopt these techniques, I think, and before surgery, by the way, not after the fact, and
yes,
prepare for it, I think it make a dramatic difference in the well-being of patients.
dramatic, and we even see that in our patients, Shash. You and I both know that if someone goes into even our surgical procedures with that frame of mind, that you're going to do well and that we're going to do what's been prescribed, but that we're going to do well. One way or another, we're going to do well. These people have a much better, not outcome, but much better post-operative course. And we're, certainly something that we're integrating here into my practice, into my patients, and believe very strongly in this, and much more so now than before. I think my attitude has changed, 180 degrees. I always believed in power of the mind, but even taking that one step further to bring in the spiritual, to bring in the breathing, the just even the meditation, and not just the physical part is so important, and much more than I even gave credence to in the past. And I think we're at a very early phase, but it's something that we can encourage in our patients. And frankly, I've spoken to a lot of people that have undergone similar situations or similar cancer to what I've had, and usually it's in the post period where after I finished my 8 months of treatment, it actually gets a little worse, and it's the 6 to 8 weeks afterwards where everything is burned up from the radiation and your throat is on fire, and people tell me they've lost 45 and 50 and even 60 pounds, and they just can't. It hurts to chew and everything. And I said, I hear you, but we're going to work on our mind over matter, our spirituality, our thinking. But you have one job to do. And that's number one, is to get your calories in. That's your job. Number two is to get your exercise in. That's your job. Number three is to be positive. That's your job. And number four is to start focusing on the getting better part. And even though can be uncomfortable, you have to reach through that phase and not feel sorry for yourself. It's time to work. You have the job. You got to get your 3,000 calories in a day. You got to count your calories. You got to eat foods that are a little harder to eat. You got to start exercising that part, and you got to exercise your mind, and that's of utmost importance. And all that could not have gotten me through the first part, as well as the support of, again, my friends and family. During that time, I lived with my closest friends in Houston, and they opened up their homes to me and their love, and helped me through that, as well as, of course, my family. And that support is just, it's boundless.
This is actually not even the main part of the story. I mean, this is just like the preparation. You're mentally, physically preparing for what's about to come, which is just absolutely mind blowing. So stay
Yeah,
tuned, folks, and listen to this.
I wish it wasn't, but yes, you're absolutely right, Josh. And so for the 8 weeks after I had finished my 8 months of treatment, I got my calories in. I did my walking. I started to feel better. I started to get stronger, and started to try and come back and do a little bit of work, but really reintegrate myself into life, as it had, with changes. But a year goes by, and I'm still gaining my strength, but really feel great, as good as I had. I'd been back trying to train, do as much as I could, with my limitations as they were. And it's exactly 12 and a half months after I finished my treatment, and I go into Houston for my best friend's daughter's wedding, and we have a great time. It's June 24th, 2023, so this past summer. And 2 days later, I was scheduled for my 1-year PET scan, which is a scan, of course, which scans for recurrent or tumor activity. And I get that on that Monday, June 26th. I fly back to Atlanta that night, and I'm in my clinic the next day seeing some patients, and I get a call in the afternoon from my oncologist, who's a wonderful, wonderful person at MD Anderson. And she says, "Miles," I said, "Renata, why are you calling me?" And she says, "Well, I did not like what the PET scan showed." And that kind of took my breath away, as you might imagine. And I said, "Okay." She says, "It's not been read yet, and it might not be this, but there were several sites in your chest behind your breastbone that were lighting up on the PET scan." And I said, "Well, give me 5 minutes and I'll have it read for you." And I called my colleagues, the chiefs of nuclear medicine and neuroradiology, and 5 minutes later she calls me back and she said, "How'd you do that?" But it was read, and unfortunately I had to return to Houston and get a biopsy of these lesions, which all turned out to be positive metastatic lesions around my.
So the cancer treatments that you had your tonsils removed, you had chemotherapy, you had radiation therapy. So that did
And
not
immunotherapy as well.
that did not take care of the cancer.
Right. The cancer had shrunk all the way from below this level, and everything that was radiated, including my area above my clavicle, my neck, my throat, all that was okay. But they were in around my windpipe at the time. There was a 5 millimeter lymph node and a 7 millimeter lymph node, which is very tiny. I mean,
Normally we wouldn't pay too much attention to those.
right, but they went away before I had the radiation therapy, the proton radiation therapy. So they didn't radiate below this level. And unfortunately, that's where everything came back. So there was and before I had the radiation therapy, the PET scan did not light up in those areas. So it looked like they had shrunk away, they'd gone. So what happened was, obviously there was some microscopic disease that was non-detectable. And over the course of the year, it had ballooned up. And now I had large nodes, more than 2.5 centimeters in size, surrounding my windpipe, surrounding my aorta, surrounding my heart, and surrounding my esophagus. And I was truly stunned because, again, I felt fine and tried to process this. And I, again, not knowing a lot about, the darker art, shall we say, of oncology, and radiation therapy, I, of course, fly back to Houston to discuss what my options are. And at the time, I qualified for a dual immunotherapy trial. But what I had done, of course, again, is take control of my destiny, where I did a lot of research, and I found for instance, in Germany, that they have a antigen-specific tumor vaccine that they had been using for 10 years that had some success. I found several other options to add to my therapy should this trial not go as well as I had hoped. The only other interesting thing is when I did meet with the trial coordinator, she said to me that, well, it's a 2-year trial where I would get this dual immunotherapy every 3 weeks. And I said, well, that's a really long trial because I do a lot of FDA trials here in my office. And she goes, well, yes. And if you're doing well, then it may be for the rest of your life. And that's when I kind of said, well, let's talk about that for a minute. What are you saying? She says, well, if you're a responder, which 40% of people are to this, then you may get 20 to 30% shrinkage of your tumor. If you're a non-responder, maybe you'll live 2 years. If you are a responder, maybe you'll live 5 years. And I looked at her and I said, you don't know me. I said, I'd never lost at anything in my life. I don't play for 20 or 30% responses. I only go for 100% responses. And I said, but thank you for the information, and I'll take it under consideration. And then I talked to my oncologist, and I said, look, I'm already looking into some other treatments. I'll start this. But as you know, drug trials are meant to see if those particular drugs are going to work. But I said, look, if I do this trial and I plateau or I don't respond, or if I only get 20 or 30% shrinkage, then we're going to go on to the next thing. And I'm going to go to Germany and get the tumor vaccine. And I'm going to do this and that, because magic bullets a lot of times are not one single course of therapy. There are a lot of things. And there are huge advances being made at all times, especially in cancer treatment that happens on a daily basis. And she, of course, said, of course, that's absolutely what we're going to do. If you show any signs of non-progression, then we're going to move you out. And I said, and we'll get started on it. So I proceeded to get started, and after the first treatment, the next day I fly and meet my son in Jackson Hole, Wyoming, and went rock climbing and whitewater rafting and mountain biking.
This is the Doctor You Don't Know Me Miles.
Exactly. Exactly. So, with the 2 to 5 year prognosis in terms of my demise, if you will. But, I did not accept that. That's just what they think. That's not what you know. And all you have to be is that one person, the one. And as I said, I don't accept when people even quote that. And I think that's an important point. Anyway, I then 3 weeks later got my second dual immunotherapy treatment. And I get on the plane and I fly to Europe to meet my wife, to drop my daughter off in France for a semester, and then fly to Cambridge, England, to go to my goddaughter's wedding. And the next 5 days, I was fine. But then things began to go south really fast. As the clock struck midnight, interesting enough, on the Saturday night, 6 days after my second treatment. So here I am in Cambridge, had a great time at the wedding, was feeling pretty good, and all of a sudden, I was not. I started to get very short of breath, and I felt nauseated. And the next day, I basically started, we were touring, and I couldn't take more than 2 steps without getting lightheaded and dizzy and short of breath, which is not me. And I said, something's really wrong. I couldn't really, my stomach was hurting, my legs were hurting, everything was hurting. I thought it was probably hypothyroid crisis, which the immunotherapy had taken out my thyroid, and I was on thyroid replacement. I thought I needed more thyroid medication. So I called MD Anderson, which I was scheduled to go back to 3 days later to make sure they got a thyroid profile test. In the meantime, I kept getting worse and worse. And I flew myself. My wife was going on to do some traveling. And I flew, but because I'd done so well after the first immunotherapy that I didn't think anything of it. So I flew myself the next day in the morning to Bordeaux, where I was going to go wine tasting. But I could, at that point, I could barely move. And I tried to sleep. I couldn't sleep, threw up numerous times. And I was leaving at 2:00 in the morning, the following morning, to catch a plane to Paris and then go back to Houston for some blood tests. So now I kind of wake up at 2 o'clock in the morning now, several days later, and I get up, and it's gotten to the point where one step, I'm not sure how I even made one step. I felt like I was on 18,000 feet of Mount Everest with a big backpack, a 200-pound backpack on my back. But I did. I put one foot in front of the other, and I caught a taxi to the airport, and I somehow made it on the plane, and I made it to the Charles de Gaulle Airport in Paris. And I got off the plane, and I could barely move at that point. And I sat down for about 45 minutes trying to collect myself and just say, come on, what's the matter with you? Get up, let's go. And I ended up walking. For anybody listening that's been in the de Gaulle Airport, you know it's a very confusing, very difficult airport to move through. I ended up walking probably 2 kilometers the wrong direction before finally saying, where is P2 SG F1? And someone says, oh, monsieur, it's about 2 kilometers back the other way, and you go down, you catch the bus to the main terminal, and then you walk another kilometer to the gate. So I managed that. And at that point, I hadn't really had anything to eat or drink or keep anything down for about at least 50 hours or more. And I actually asked somebody that I saw with a wheelchair to roll me down to the gate, which the person refused, because it is France, and that's just kind of how it is. But I'm actually lucky. A lot of things happen, and I know there's a higher power that was looking out for me, that God was looking out for me, that the person refused, because I did make my way to the gate. If I'd gone down there in a wheelchair looking the way I did, they never would let me on the plane. But I, of course, dragged myself down and looked really good, and got on the plane and had my own row, and then proceeded to fly to Houston with the longest, probably 12 hours of my life. It was probably the 12 hours felt like 12 years. I could not get comfortable. I kept checking my Apple Watch, and it kept saying that my pulse was 40, and I passed out 2 or 3 times in the bathroom on the airplane. Couldn't. I tried to drink water, and I just throw it up. And finally, with an hour left before getting off the plane, one of the flight attendants says, "Monsieur, are you okay?" And I said, "Well, maybe you can have someone meet me at the gate with a wheelchair," and which luckily they did. And again, somehow, some way, the higher power was looking out for me. God was looking out for me. They met me and got me through customs and got my bags, and I had them roll me out. And I said, "See that taxi? Take me to the taxi and let me get in it." And I go down there and I lift my bags into the taxi, and I say, "Take me to MD Anderson emergency room." And I called my friend who's the chief of plastic surgery at Methodist, and I called my oncologist, and I'm in the back of this taxi. And I said, "Hey, I'm really feeling bad. I think I should go to the emergency room instead of just the blood work." And I said, "Absolutely. You go to the emergency room, because you sound like you're not doing well." So I can't even imagine what I sounded or looked like at that point. So it was quite fascinating. They, of course, dropped me off at the wrong location at the front, where, again, I had all my bags from Europe with me. And I said, "Can you guys at MD Anderson put me in a wheelchair and take me to the emergency room?" And they did, and I had my bags with me, and I get over there, and they're checking me in. And it's a little bit of a different emergency room than you and I are used to, in that everybody at MD Anderson has cancer. So they have one little room on the downstairs level, and then one kind of a crash room, a trauma room, or a real emergency room on the second floor. But they're checking me in, and they're checking my vital signs, and they have the blood pressure cuff on me. And it's on me for about 2 to 3 minutes. And I said, "Hey, the blood pressure cuff is still squeezing my arm." And the guy says, "Well, Dr. G, I can't get a blood pressure." And I said, "Well, change the cuff." And they changed it 4 times, and each time said, "Dr. G, I can't get a blood pressure." And finally, that's the first time, because I'm sure I was a little delusional by that point, because now it's 72 hours that I hadn't really eaten or drunk anything, and I felt this way. I reached over and I felt my own pulse. And I said, "So my pulse is about 20. It's very thready. So let's go back in the room back there, and let's get an EKG and start an IV, because I'm really dehydrated." They said, "Oh, that's a good idea." So they rolled me back there, and I jumped up, and the first person in the room is the EKG tech. And so it's just me and her, and she does the EKG, and you got to pardon my language, but she looks at it and she goes, "Oh, shit." Pardon me, that's just what she said.
So we can pause and take a breath for a moment here because there's a lot going on here.
Yes.
So you alone flew from Paris to Houston with with possibly a bradycardic situation, which with the pulse somewhere between 20 or whatever it was,
Yes.
which is difficult to imagine you were functioning because I mean, you can have supreme athletes in their 40s or maybe in the high 30s, but it's for normal people, and you're not a normal person, but it's not compatible for function or anything.
No.
And then on top of that, you had no blood pressure to speak of, so we don't know how you're perfusing, and you were still cognitively there to guide your own care in a way.
That is very succinct and miraculous in that you and I both know that most people with a pulse of 20, turns out that I was in what's called complete heart block, where the electrical pulses of the top part of the heart were not communicating with the bottom pulses of the heart. So I was just
The receiving and the pumping sides, basically.
exactly, and they were not communicating. So it was my perfusion and rate of 20 was mainly a what we call a ventricular rate, depending on these little bitty Purkinje fibers that in that rate most people last for maybe an hour. So I could have probably had a cardiac arrest at any time in the last 73 hours because I was in that rate for at least 73 hours. So something.
I mean, not only were you in that rate or something in that neighborhood, but you're physically active in a demanding, physically active situation. So, I
Yes.
mean, that doesn't even sound believable or plausible to me.
Exactly. No one can believe it. And in fact, the cardiologist, which is the next part of the story, still come in, they shake their head and they go, we have no idea. We've never had anyone in your condition as sick as you walk into the emergency room and then proceed to basically call your code or yourself, which is the next part of this crazy story. And because I'm the only one in there with the EKG tech, when she says, "Oh shit." And I said, "Let me see that, please." And she hands me the EKG, and I can see that I'm in a complete heart block with a rate of 20, which is a third-degree heart block, and that is a true medical emergency. And there's only one treatment for that, and that's a pacemaker. An emergency. I said, "Do you have a cardiac cath lab here?" Because I did not know. I said, "I need a pacemaker right this minute." And she hits the bell, the code red button, and all hell breaks loose, and they rush me on a stretcher upstairs through the elevator to their crash room. And all of a sudden, there's 20 people in there, and they proceed to put 8 IVs in me, and they're not getting any blood back because I'm not perfusing. And they want to, put a line in my groin, and then they want to start pressor agents, which you and I both know, if you're that dehydrated, can lead to vasoconstriction of your extremities and possible loss of your extremities. And I said, "No, you guys, I need all these are in. I need to be perfused, and I need a pacemaker." Again, someone and God's looking out for me because the cath lab was leaving in 20 minutes, and they of course mobilized them, or I would have been in big trouble. But now there's 30 people in there, and they want to put these pressor agents in, and I said, "No, I'm in. You're not giving me any of that stuff. You're going to perfuse me. You're going to get this pacemaker in, and that's the treatment. And so don't even come anywhere near me with those agents. Go ahead and let's get this thing going." And the next thing I'd called my oncologist and my friend, and she had come down to the emergency room. I said, "I'm in complete heart block right now. You need to come down here." And next thing I know, I wake to a chest compression. So on hour 73, I finally flatlined, which I came to find out a few days later, over the course of the next 2 weeks, that I had been flatlined for 11 seconds or possibly more. It varies in the I think in the telling, depending on who I asked, and figured out finally. And interesting enough, I do remember the time that we can certainly come back to and talk about, the time that I was asystolic. I do remember vividly what happened in those at least 11 seconds.